Hi, everyone. My name is Christy Scher, and I'm the VP of Health and Wellness for the MBAA, and I want to share with you a therapy resource guide that we have put together for therapy in Durham and therapy as a Duke student. So today we will review Duke provided services, which includes CAPS and Blue Devils Care. We will look at services outside of Duke, which are Psychology Today, My Resource, and a crowdsourced Durham therapy guide. We'll also look at some therapy tips and then what is to come. So starting with CAPS, CAPS stands for Counseling and Psychological Services, and they are our on-campus provider. Some things to know about CAPS, first and foremost, is that all services are completely confidential. CAPS legally could never be in contact with Fuqua or any professors. Anything that's outside of CAPS, they cannot communicate anything regarding your information as a patient. The next thing to know is that all staff specialize in student mental health. They are all trained specifically to be in an on-campus resource for students. Not only students, they're also trained with Duke students, so high-performing individuals as well. The next is that all services with CAPS are free. There is no insurance taken. This comes from the student health fee that you pay within your tuition, so no additional fees are taken. You are already technically paying for this through your tuition. Now, CAPS offers individual, couples, and group therapy. Some examples of group therapy include grad school student sessions, grief, and then things like adjusting to the US. And they have a number of other programs that you can find more information on their website there that I have listed below. You can find CAPS on the third floor of the Student Wellness Center. I've included a map here. The dark blue building is Fuqua. So if you go outside of Fuqua and the front doors, you turn left on Science Drive and you walk until you get to the traffic light. Then you make a right and you walk up that slight hill and there'll be the Student Wellness Center on your left there. It's about a 10 to 15 minute walk from Fuqua, depending on how fast you're walking. Moving on to what CAPS actually is. So they are a brief therapy model. I have been working closely with Lisa Adams. She is the new director of CAPS. There's been a bit of a transition. So the reason that we're level setting what CAPS actually is because there's been a lot of myths and a lot of grievances with CAPS, but we want to level set that what CAPS actually is, what they offer, and why things are the way that they are. So one thing to note with this brief therapy model is that it's time limited and present oriented. So that means if there's certain issues, maybe you have been dealing with something like bipolar for the last 2 years of your life, you know that you need to see someone every week or every other week, you know what type of medication you need, then CAPS probably is not the right place for you. However, CAPS is a service that will link students to the best care possible. So this means that you can still go to CAPS and you can tell them with that specific example, and they will provide you to a referral that's outside of CAPS, and they are with vetted practitioners. They have a whole council that vets all practitioners in the area, so they know that they meet the needs of students and that they are reputable. There are no session limits. This is another myth that has to be dispelled. Some people have been told that they can only be seen for X amount of visits or, once a month, once a week, but there is actually no limit to the number of sessions that CAPS can provide. All that to be said is that there's no two students that will have the exact same experience with CAPS because CAPS is meant to meet individual needs. If you go to CAPS and your roommate goes to CAPS, your roommate might be referred outside to a different practitioner. You may be seen within CAPS, and that is just because they're trying to meet your needs to the best of their ability. One aside is that they do offer bridge sessions. So that would mean if you are seeing someone in the community and maybe they're going on vacation or their schedule is full, you're able to go to CAPS for a session or two just to bridge that care until you get back to your regular practitioner. Just one thing to note. Now, how do you get started with CAPS? There is a nuance between first and second years. First years, your coverage starts the first day of your classes. So you are going to have to wait until August to take any action if you want to go through CAPS. Second years, your coverage is active now as long as you are enrolled in spring 2022 classes. In terms of hours, CAPS is open this summer, including, from today until August 21st, Monday to Friday, 10 a.m. to 3 p.m. you can walk in. And then from August 21st to the end of the school year, they will be open Monday to Friday, 9 a.m. to 6 p.m. That August 21st is because that's when the undergraduates come back, and Duke sort of functions around the undergraduate calendar. Now, what to expect when you go. So the first thing you'll do is you will either call or walk in on those days when you are eligible to go to CAPS. And they will give you paperwork. It's about 15 minutes of paperwork. You'll have some historical information and also what your current state is. Now, with my experience, anytime you go to any sort of therapy practice, they will ask you questions that can be a bit deep and very serious. So they will ask you about suicidal thoughts or tendencies. This is protocol. They legally have to ask you these questions. So, you oftentimes, if you go, you might be feeling vulnerable already, and then you ask these questions. Sometimes it can be a bit jarring. So just know that that is normal and that must occur for you to even be seen by a practitioner. The next phase is that you'll have an intake session. Lisa assured me that the intake session will actually happen within the hour, but I want them to under promise and over deliver. So I'm saying that it will happen within a week. She's assured me that their processes have changed from last year and they will be much more efficient. So one thing to note is that it will be in a timely manner. And then finally, you'll be either assigned to a CAPS counselor or an outside specialist. I have linked the directory for the CAPS counselors because another myth is that all of the counselors are of a certain ethnicity, or maybe they're all American, but there's different CAPS counselors of different ethnicities, genders, all sorts of things. So hopefully you will be able to find the counselor that is right for you. And then as far as outside specialists, one thing that Lisa mentioned is that students will often come to CAPS, they'll be referred to an outside specialist, and then they will feel a bit rejected as if their problems are, too major to be seen by a CAPS counselor, but this is not the case at all. If we think about it in terms of a sprained ankle, you can go to your general practitioner and tell them, I have a sprained ankle, and they could look at it and be like, yeah, you should elevate it and put ice on it. Or you can they can refer you to an orthopedist where that person has probably seen 5 million sprained ankles and they can give you the exact care that you need. Whereas maybe the general practitioner has only seen 400 sprained ankles in their time as a general practitioner. So just know that if you are referred outside, it's not that there's anything wrong with you. It is just that there's better care outside of the CAPS facility for your specific needs. The next offering that Duke has in terms of mental health care is Blue Devils Care. That was the original name. It's now going to be just called Timely Care, which is the actual app provider's name. So with Blue Devils / Timely Care, you get free 12 sessions. This is all virtual care. It is through an app on your phone. And you get 12 sessions per issue. So if you go today and you're working through a breakup, and then maybe you want to come again in 3 months because your grades are slipping, then you can have another 12 sessions because that is a separate issue. So it's almost endless if there's different things you want to work through. The other feature they have is Talk Now. So you can open your app, you can click a button, and you'll be connected with a licensed clinician, and that is immediate. So the reason that you would use Timely Care as opposed to going through CAPS is maybe you need more flexible hours. They have appointments at 9:30 at night. They have appointments on weekends. They're just a bit more flexible. Also, for second years that are in different states right now with their internship, you are able to see a clinician that is in California or in, Texas, you can see anyone. You just have to inform them that you are in another state, because if you want to come back to North Carolina and continue your care, you have to ensure that they're licensed in both states if you want to continue seeing the same person. If you want to start over with someone new, then it's not necessarily an issue to go to North Carolina licensed practitioner. I have linked Blue Devil's Care here, and you can see the app that you can download and have more information there as well. Now we will move to resources that are outside of Duke and CAPS. So the first is Psychology Today, and I will walk you through how I would use it to find a therapist. So it brings you to this page, and the first thing you do is type in the Durham zip code for wherever you are, and it brings you to this page of all therapists in the area. The first thing that I would personally do is limit it to the insurance that you have. So students often have Blue Cross Blue Shield. Maybe you have an outside one and you can find it there. Then I would limit it to the age. So I would click adults. And then from there, it's really your personal preferences. I personally only like to see female therapists. That's a personal preference, just something that I've come to notice over the years. And if you click more, they'll have your different ethnicities, sexualities, languages, and faiths. So you can limit it to any sort of identity. And then another thing is that they have issues here. So if you have something specific, you can click on it, or you can just leave it for sort of a general care. They also have types of therapy. I would also leave this blank unless you know that there's a type of therapy that you specifically like. However, I've been going to therapy for years and I couldn't necessarily tell you which therapy I would do best in. I prefer to leave that up to the actual practitioner. And then you can also click on price. I tend to not filter on this because I prefer to find the therapist and then have an actual intake session with them to understand pricing directly from them, because I found that sometimes it's not always too accurate. And then if you see here, they have the option for sliding scale. If you don't know what that means, all it means is the therapist may offer their service for $100 per hour, but based on you being a student and things like that nature, they'll only charge you $30 because the idea is to have therapy be accessible to more people. One other thing to note here is certain therapists will have this noted that they're not accepting new clients. So they'll still be listed, but just take note because it's been a little bit better, but post-COVID, there was a really high demand for therapy. And so you can see there's a few that are not accepting new clients. So if we want to just say we did all of our filters and then we said, okay, Nikki looks like someone that I would like to see. You can read here, they'll have a little note, maybe it will say you can have a free intake, which is always great. And then you can see, is it just in person? Is it online? You can read about what they specialize in. Over on the right here, they can say what ages they focus in. And then of course they'll have their insurance plan. Again, they will have their cost per session, but I would still call because the copay might be different from that actual cost per session. And then sometimes they'll also have their website. So I know Sarah here, even though she's not accepting new clients, she'll have her website linked so you can get more information there as well. So this is one of my favorite tools to use. I found all of my therapists in New York through this website. I think it's also, even if you don't want to use this while you're in Durham, it's really great to know for after you graduate and move away. The next resource we have is called My Resource, and this is actually a Duke startup. It was started by a Duke student. It's similar to Psychology Today. I'll walk you through this one as well. So for location, we can type in Durham. You can select whether you're remote or in person. And then right away, they have this filter here. They have a bit more niche specialties. So if you want to go through that, you can click career. I know that's something that's very relevant for all of us. or you can leave it blank again and search. And again, you can see the specialty, the payment, all sorts of different filters. One thing that CAPS did mention is that they work very close together with My Resource because they are a Duke student. And so they have vetted a number, if not all, of these therapists as well. So you have that double check from CAPS as well. So that's another resource if you do not want to go through CAPS to find your therapist. And then our final resource is with a crowdsourced list of class of 2023 students that have seen different therapists. So we have their names, their website, if they're a psychologist, psychiatrist, or a therapist, if they take the Duke insurance, and then if they have any sort of thing that they're especially good for. So, you know, whether it's anxiety, learning disabilities, people of color, those things are really important. So it's really nice that someone's already vetted them. We even have someone here that says best therapist I've ever had, which we love to see because it's such a sigh of relief once you find someone that just you click with. So those are our outside resources. So just to reiterate, you can always go to CAPS first. But if you, for whatever reason, don't want to, you can use these 3 resources instead. But CAPS will also give you that outside referral if you'd rather just have someone else do the work for you, if you don't want to make the calls, all of that type of thing. Next, we'll just look at some of my personal therapy tips. I also just want to reiterate, I am not trained in any sort of way. I have just had the experience. I had separation anxiety from a pretty young age. So I was going to therapy when I was like 9 years old, when I didn't even know that it could be, you know, stigmatized or anything like that. So I will say I have been around the block in terms of therapists. So some things that I've picked up either from my own experience or from therapists is that in general, it's great to give a therapist or therapy 3 tries. The first time you go to therapy, if it's your first time ever, you will probably want to bolt and leave the room immediately. And that is totally normal. It's just the discomfort of, you know, maybe you're being vulnerable for the first time, or you're sharing your emotions. You've never had a safe person to talk about these things with, can be very scary. The second phenomenon that happens is your body and your mind finally feel a sense of safety. And so sometimes during that first session, you will just cry uncontrollably, and it's very confusing because you're like, I'm not sad, I have nothing to cry for, but it's just your body releasing like the feeling of not having a safe person to talk to. So that's one thing I've also picked up on, and those are completely normal. I will caveat this with, I'm not saying if a therapist makes you uncomfortable or says something offhand, that is never acceptable. Please do not go to them 3 times. It's more so if there's nothing wrong with the therapist and you just feel the need to, you know, get out of there as fast as possible because you don't want to talk about your feelings. That's when I would encourage you to try that 3-time method. The other thing that I've picked up on and is about highly functioning people. So oftentimes therapists or counselors are trained in situations where they're dealing with people with very severe mental health conditions. Maybe they're training in a psychology ward of a hospital, or maybe they're training with someone that's has severe schizophrenia. And oftentimes, if they then transition to private practice and are seeing people that can get out of bed in the morning, can have healthy relationships, can take care of themselves in general, sometimes the level of care is a bit different for them and they're not able to transition. For example, when I was in New York and I would go to a therapist after work, I was always dressed up. And one time she had said to me, you know, you always look so put together. It's so hard to believe that you would be dealing with any sort of anxiety. And that was an instance where I did not stay for 3 sessions because that is completely ridiculous. You can have a great outfit on and still have issues with anxiety. And so I think my learning from now on is that I will always ask, do you have experience with, or have you had training with highly functional people? I think it's just saved a lot of time and energy, because then like the feelings of guilt, like there's people with real problems, that's never okay. You will always have room to discuss what is going on in your personal life. And lastly, my favorite tip is that I love to get a reward after every session, especially if you're trying therapy for the first time. You know, maybe it's a fancy coffee drink or ice cream, just anything to reward yourself for taking care of yourself. It just makes the whole experience much better, especially if you do have those big releases of emotion, and just, you know, taking the time to take care of yourself through therapy, but also, you know, in a fun way as well. So that's just my 2 cents. And then what is to come? So we will have a field trip to the Wellness Center from Fuqua. We'll walk over together either in August or September. We'll have a little bit of a meet the therapist, you know, we can walk by, see what CAPS looks like. We'll also see what the Do Well Center has. So they offer things like yoga and tea tasting. They have some massage chairs. So just showing those resources as well. The date is to come. This will be similar to our walkover from Fuqua to Wilson that we're going to have the first week of August. You'll be able to find details for that, as well as details for this once it's posted on Fuqua Connect. And then lastly, if you have watched this whole video and you have never been to therapy, we will have more content on what therapy actually is. I think sometimes people think it's about spilling your deepest, darkest secrets, but sometimes it can be as simple as, I really don't get along with my boss. What do I do? So more content to come on that. And if you have any questions, please let me know. You can send me a Slack or an email or anything. I will be at orientation. I'm really excited to meet everyone, and I will obviously be equally as excited to be reunited with the second years. So thank you for following along, and I hope you get some knowledge out of this session. Thank you.